I think the paradigm shift for cancer, going from a genetic disease to a mitochondrial metabolic disease, will have every bit of tumultuous change as did the Copernican revolution. Because if in those days it wasn't, if you thought the sun was the center of the solar system or the Earth, whether you agreed or disagreed, it wasn't associated with 1,700 people a day dying. Our misunderstanding of this situation today, that cancer is a genetic disease, is absolutely responsible for the 1,700 people a day dying. Those people are dying because they're being viewed as having something other than what they have. They do not have a genetic disease, so these precision medicines that are all based on the somatic mutation theory are indirectly allowing the field not to move forward. And as the result, we're getting all these poor people that are dying. So the consequences of not knowing what you're talking about scientifically have dire consequences for people. The suffering and death is enormous that we're seeing with this cancer today. And that's all because they refuse to accept the Warburgian, the idea that this is a mitochondrial metabolic disease. And revenue generation is more important than patient outcome. We know this for a fact. The National Cancer Institute says it's a genetic disease, funding millions of dollars in grant support on a flawed theory. So we're getting more and more dead people based on a lack of knowledge or ideological dogma that's preventing the transition. And
So with your view of mitochondrial metabolism taking center stage in terms of cancer, what are some of the best and simplest ways people can manage their lives to prevent cancer? Would you say that people should be going into ketosis one way or another, at least intermittently, as part of their strategy?
I think so. And exercise plays all we're doing is bringing ourselves back occasionally to the Paleolithic period where cancer was not prevalent. How do we know that? From the work of Albert Schweitzer, looking at tribes of people that live according to their traditional ways. So yes, I agree. I think that as long as we are aware of what we need to do and how to do it, then it becomes our job to act upon that. But right now, the misinformation associated with the food pyramids and with what cancer is, this level of misinformation is causing a tragic consequence to the health and vitality of our population. So yeah, we can prevent cancer if you can keep your mitochondria healthy. It's very hard to get cancer when mitochondria are healthy because mitochondrial dysfunction is the origin of cancer. So maintaining metabolic homeostasis is absolutely essential for preventing cancer and other chronic diseases. So it's not bad luck. It's not this crazy nonsense that you hear about people talking about. It's our diet and lifestyle issues that predominantly are responsible for our health.